Next patient we have is 26-year-old male with known comorbids presented to us with complaint of altered bowel habits and weight loss for 4 months. There were no positive findings on abdominal examination, DRE and proctoscopy.
Thank you.
Oh, Lal, what are you doing? Why? Why are you so serious, man?
I'm not serious. I'm tired actually.
He's always angry.
Angry? He's never angry. He's always happy. He's happy. You've got small hands. 6?
6.5.
Okay.
आप उधर आ जाओ यार, मामा उधर आ जाओ। सेडेशन पे देखो, हम उधर जाओ। स्कोप रेडी करो, अपना सेक्शन रेडी करो।
So how many have you done again? How many procedures have you done?
Mostly 10.
Mostly 10.
Mostly 10.
Mostly 10. 2. For mostly 10. So he's just asked what they're going to give sedation wise. So it's 2 because you're mostly 10.
Yeah. He's fighting with ball.
Good ball. Hello, 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 hello. I'm a hello.
Hello, yes. We are with you, Paul.
What? Oh, that's ominous. Hello.
Hello. Yes, we can see you and hear you.
Internet is not working. Oh, do you know? You cause me stress. So, my friend, we need someone to tell them what's happening here.
Okay.
So,
So I go for the DI
not yet. Well, hello?
and have to change my gloves to this uncomfortable short.
Are they too small? I told you.
Yeah, but
He put 6.5.
they are tight. So, yeah. So no small finger. They are tight so much. 7.
You're on. You need to tell them what's up with the patient. You already told them already. So what's wrong with the patient?
History of altered bowel habits and weight loss. There were no positive findings on abdominal examination, rectal examination and proctoscopy.
Okay.
There you go.
So I go for the DI.
You can. Are you happy with them gloves?
No, I'm not happy.
Well, take the gloves off.
I do DI and I put.
Yeah. Thank you.
Waiting for internet.
Waiting for the internet. Internet. 2. Let him know what you're doing before you do it. Eric.
Aslan, 7 number का गिलाफ दो सेट को.
रीमा सारे ग्लव्स यहाँ पे रखवा दो ना सब नंबर्स के.
He put the wrong size gloves on Saturday.
Oh,
And
okay.
so he then says, what should he do? I says, well, do the DRE with the wrong size gloves and then put the right size on.
Oh, okay.
I did question him when he was putting on the tiddy gloves.
Yeah, we heard that.
Is that better?
Yeah, it's better.
Good. So is the patient okay? Is the patient okay? Oh, wait. Yep. So 2-2? Yep. He's had. So a little bit of air. Good. A little bit of air. Slow down. Good. Right. Stop. Stop. See how you got the scope up into the air? Finger away from the air. Just finger away from the air. Stop. Watch what you're doing with this hand. This hand is doing this.
Yeah.
Straight line. Stop. Look. What you're doing is this. Keep your finger on the scope and allow the scope to point in a straight. That's better. Slow down. Advance slowly. Slow down. Advance slowly. Good. Slow down. Good. Right, stop there. Just no, don't mean draw back. Just stop. In, tip up. Nice and slow. Nice and slow. Finger off the blow. Tip up. Tip up is that. That's it. Keep it coming back. Finger off the blow. Okay, slow down. Okay. Just slow down. Nice and slow. Slow down. Come back with the scope. Now, can you see where the lumen is? Again, can you nice and slow. The scope you've got is actually buckling in your left hand. Oh, thank you. You're fine at the moment. If you look at the scope, can you see the scope in your hand? Right? Watch. I'm going to just show you, and then I'm going to hand you back the scope. Stand here. See how you've got the scope? You've got the scope like this, and you're doing this. Right. No. Right. Neutralise your wheel, the big wheel. The little wheel was kicked forward. The little wheel was forward. 10-2. Look at the lumen. Anti-clockwise. Clean your lens. That's all we've done there. Tip up. Tip up even further. And that's your, yeah? And see this finger? This finger's pointing to his anus. More gel, more jelly, and then you can go forward. See the scope? See how I've got it in a straight line? Finger, more jelly. Yeah. Thank you. Slow. Slow. Good man. Slow. Right, just pause, stop, and look at him. Look at his feet, and look at him. Okay? So, if you apply this, look at the screen, and tip up. No, you apply this, you hold this. Hold it. Now, tip up. Hold that. Hold it. No, don't let go. Pause. Back a bit further. Now slowly advance. Yeah? Take some of the air down. You're putting too much air in. Good man. Good man. Good man. Good man. Slow down. Slow down. It's not a race. Okay? Now, slow down. Allow this to come here. Slow. Keep it on. Keep it on. And stop. Draw back. Off. On. No, push. Advance. Now, pause. You've got your finger on the blow continuous. That's what's causing him the problem. Okay? Take some of the air down. Let's get the air out so they can get the air out. Is that better? See, too much air. Made him very uncomfortable, okay? Where's the lumen? No. See it? Slow down. Slow down. Slow down. And what we're doing is we're going up here. Slow down. Slow down. So how could we make this easier? Young man, how can we make it easier? Huh?
See the trumpet.
You could.
This. Now we have seen that we have to go
Yeah.
for it.
Stop. What's he say?
He's saying
Okay.
can
Okay, so let's put him onto his back. Yeah?
you see that?
Keep your finger away from the blow. Good man. Good man. Right.
He's complaining a lot of pain.
Okay. Let me just take some of the air down for you. Is that okay? Brilliant. Let go. No worries. So, if you notice, I don't grab the scope in any way. Right? Do you see how there's tension in the scope there? So, we'll just take some of this air down. How's he now? Okay. Over-insufflating. Again, you've got the little wheel pulled back. Right? So just let that scope come back. Now, watch. You've got the scope here. Keep it in a straight line. Nice and slow. Watch the patient. Nice and... This finger is not blowing. Okay? Nice and slow. Nice and slow. You see? Yeah? Slow. Slow. Nice and slow. That's better. Nice and slow. Well done. That's it, brilliant. Slowly do your wheels. Everything is slow. Good. Not too much air. And you can see where it wants to go. Good. Much better. Much better. You can't see his hand, but he's actually got his finger along the scope now. He understands what I want him to do. So the finger is pointing towards the anus. He's not insufflating as much as what he was earlier on. and so therefore the patient is now a little bit more comfortable. Also, putting the patient on the back allows the air to dissipate across the colon. So now I'm going to ask him why have you put him back on his left?
Because there is a position due to the when he's scared. I'm not seeing the mucosa.
Okay, but why have you put him back on his left?
So now I see the like thing.
But why his left?
Due to the see the mucosa and I have to push.
Okay,
No.
we'll talk about it after. Oh yeah. Nice and slow. Keep the torque on. Clockwise torque. A little bit of air. Just a little bit. That's enough. That's enough. That's enough. Good. Okay, so if you stop there, having him on his back, stop, having him on his back, on his left lateral, what that does, all the bowel drops down and it compresses the sigmoid. Having him on his back enables you to actually have a better chance at negotiating it. He's got too much air in his bowel, so that part of the bowel, instead of being like this, is kinked with the air that's proximal. If you'd have wanted to get a better look at the sigmoid, the best position for him to have been in was to be on his right lateral, not his left lateral. So personally, I would have him back on his back, and I would have one more go at doing that, and if that fails, on his right side. So what are you going to do? So what are you going to do?
Change the position.
Back पे लिटा दे.
इसको होल्ड कीजिए डॉक्टर थोड़ा सा कमर के बल दे
Good.
ओनली बैक
And then we'll put him... Now, hold the scope there and pass that underneath his feet. Get him to lift his feet up. No, he needs to lift them up. His feet.
over here.
Yeah. Yep. And the other one. Great. Now, he needs to now come on to his right side. Okay. So this is something you didn't see me do with the lady. This is something that you can... Yeah, you got? Now take the scope back 2 centimetres. Good. Now. How's that? Nice and slow. And the lumen is this direction. Yeah, so it's clockwise torque. That's anti-clockwise. So it's clockwise torque. Yes. And tip up. That's it. And now tip up. Slowly. Take your finger off the air. That's good, man. Wait. Wait. Just apply the torque and wait. Apply the torque and wait. Apply the torque and wait. And tip up. That's anti-clockwise. Okay, let me just show you. So you stand there again. Right, so we're here. Watch, I'm taking the scope back and the scope is staying static on the screen. As the scope comes round, I let the scope come round. Now blow water. There you go. Now, as we take the scope back, the bowel will actually straighten. I'm increasing the torque on the scope. Let the scope come back. Watch. Anti-clockwise. So much air here, he's going to feel so uncomfortable. As I take the scope back, the scope comes round. I'm making sure that that's neutral. And now, how's he feeling? Okay. So now we've got a scope that's easier to manipulate because it's going where we want it to go. You can see where the bowel wants to go because it's looping just a little bit here. I just wait. I check him out. How's he now?
He is a friend now.
So there's a lot of air in here, I can feel it. And when we say we can feel it, what it is that when the scope goes forward, you can feel how the bowel feels stiff. And it feels too much air.
Too much air.
Yeah. So if you actually want to blow, the best thing to blow is the water. See how I'm blowing the water? You can hear the pump behind blowing. As the bowel goes round here, you let the scope come round. See the little wheel neutral? You let the scope do the walking, anti-clockwise. Let the scope do the walking. All of this is just to let the scope go round nice and slow. See it? You can see where the bowel is. This is where you need to pay attention. This is where we come. See the folds? Big wheel forward. Clockwise torque. Lumens in front of you. Advance the scope underneath the fold. Tip up. As the tip goes up, hand off the scope because he moved. Is he okay? So, so I'm keeping my finger away from the air. Just wait. So if you look what I'm doing, I'm just trying to get the scope so it feels a little bit more comfortable for him. So you see what we do, we play it by, Wazim is actually telling you how to scope. He's telling you what to do. He's not saying exactly what to do at the wheels, but he's telling you that the patient's uncomfortable, the patient's getting better. If the patient's not getting better, you're doing something wrong. And then around. See, so much air. See how much air I've had to take out? It's very easy for that air to get in there. And so you have to be very mindful about the air. Okay? So if you look at how we want to go round, it's that you have to be careful how much air you're putting in. And you're putting in an awful lot of air at the moment, okay? So just be careful about the air. So once we straighten the scope, that's got it. So it's very difficult sometimes when you're doing these procedures, when you know where to go, you know what you need to do, but you also need to learn. So I'm going to put water in. See the water go in? Right. Some more gel, please. Thank you. So, lots of gel on the fingers. Okay, so what are we actually getting? Come on to your back now, my friend. Just lift that foot up, that's brilliant. Excellent. So, if you notice, we adjust position now. Often when people are suffering more from the procedure, you start to think, is there some pathology further round? That's what I think. But there is a lot of air inside this bowel. See how that bend there is tightly shut off? Okay, can we give him one more? I'm actually blowing water, I'm not blowing air. Brilliant, thank you. How's he doing now?
Fine.
Where? Where's his pain? I've taken all the air down, that's why it should be soft. So, what's he saying?
He's saying more pain.
Have we got water, Rima? Thank you. More water, please.
Water irrigation is attached.
No, just water, darling. Just
Irrigation is attached.
irrigation attached.
Yes, attached.
Oh. This thing?
Yes, yeah.
Stops the spasm in the bowel. If you notice, I'm not putting any air in. I'm just putting water. How's he now? Is it soft, his tummy? His tummy looks soft.
Not too soft. हवा निकाल दो हवा निकाल दो नहीं अब निकालो कोशिश करो निकाल दो वही तो मसला है ना दर्द हो रहा है
It's flat.
दर्द हो रहा है
So what I think we've got is the bowel
We
proximal.
have to do.
Sorry?
We have to do all of this. Change the position.
दर्द हो रहा है दर्द हो रहा है ओ
Right, so that's not been advanced by me. How's that now? How's he feeling now? How's he feeling? Okay. Don't put too much air in.
Yeah.
Good. Finger away from the air. Good.
Not easy.
Okay. Very good. Draw the scope back. Just a couple of centimetres. Let this wheel... Right. No, don't play with the little wheel. Let the big wheel relax. Draw the scope back 2 centimetres. Now, big wheel back. Tip up. Tip down. Right, clockwise torque. There. Right. The lumen is going up this direction. So tip up slowly. So big wheel all the way back. Keep it coming. Anti-clockwise 5 degrees. That's good. Advance. Take your foot off. Right, let that go. That's it, good. Go on. Little bit of air. Just a little bit of air. Good. We'll let you put a little bit of air in now. Good. Don't suck. You can see where to go now. You don't need any more air. Keep going nice and slow. 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 Good man. Good man. Good man. Good man. Good man. Good air in. No, that's up. You want to put that down. See? Open your stance. So anti-clockwise. Anti-clockwise. That's good. So that's down. Anti-clockwise. Good. Slow. Slow. Remember, chin up.
Yeah.
Chin up. Chin up. Chin down. Chin down. Good. Good. Anti-clockwise. Good. Keep it on. Keep the toe on. Good. Right now. Keep it on. You keep doing this.
Yeah.
No. Maintain. Maintain. Keep it on. Little bit of air.
Can I change the position?
No, you're fine. He's comfortable now. Right. So what you're doing, let me show you, and I'll give you this straight back. Look, you're kicking this wheel forward, you're doing this up. Look, you can actually manipulate the scope without actually holding it. See it? He's comfortable now, ish. That's because you're pushing. Right? If you're going to advance, look what I'm doing. This is not doing anything. I come back with the scope. Tip up. Tip down. I'm looking at where it wants to be. See the lumen?
Yeah.
Now, see the teeny eye?
Yeah.
Again, that's a sign of too much air. That's here. This area. I'm not putting any air in, I'm just waiting.
maybe no.
Lost my bung. That's grand. So you put this young man has had a lot of air put into his bowel, and that's what's causing his difficulty. Have you noticed how quick it is to put the air in, and how hard it is to take the air out? You okay? Right. You see the bowel?
Yeah.
So up and down, up and around. Keep the tension out of the bowel. One of the ways of keeping the tension out of the bowel is don't put air in. You're having a temptation to put so much air in because you can't see where you're going. But what you've got to do is actually play what's in front of you. Have you noticed what I'm doing? I'm doing on-off with the scope. So I'm doing this. Rima. Hello. 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 See the bowel? I'm not putting any air in. Nearly. Right, my friend. So clean. So put your foot on that pedal. Okay, stop there. Right.
Go forward.
Yeah, if you can. Now what's that in front of you?
This is Hika.
Yeah, but what's that?
It's knee training.
Okay, so where will the IC valve be? 12 o'clock. See, it's got the bow, so it'll be here. 11 o'clock. Come back. Slowly. Tip up. Come back. Come back. Tip up. Tip up. Up. Tip. Too much. Too much. Too much. So slowly apply the tip up. Too much. Right, clockwise turn. Right. Have a look again. Slowly tip up. Slowly tip up. Slowly. Blow. Blow. Air. Tip up. No, you don't need to talk. Look, you don't need watch. Right, look. Just going to clean the lens. Right, you're here. Right. That's the appendix. See the appendix?
Yeah.
So the appendix shaped like that will say that the IC valve is here,
Just I grab one.
up here. See it? Blow water. And if you notice, all I'm doing is just letting it come up and then down.
Can I try? Okay.
Once we get in.
I try.
You see? See where it is? Just there. See it? Up.
Okay, I try.
Good.
Right. Under the fold, so you need to come back just a fraction. So neutralize this. Clockwise torque. Yeah? Don't suck. Slowly tip up. Draw the wheel, draw the scope back 2 centimeters. Stop, tip up slowly. Clean your lens. Right. Draw it back 1 centimeter. You keep going tip up. Draw it back 1 centimeter. Now, tip up slowly. Can you see the fold? That's now turning. Anti-clockwise. Tip up. Centralise your view. Bit of air. Centralise your view. Centralise. Let me get the view for you again. Okay? I'll show it you. Once more. Look. You're here.
Yeah.
Okay? You're right on the money, as they would say. You're too far in. Come back. Come back. Come back. It's here.
This fold.
This fold. Here. That fold. There. That's where you want to be going. Okay? That's it. See how much air is in there now? The too much air makes it difficult. Blow water. There. Opens up.
Yeah.
Blow water. Okay? One go, and then if that's not successful, we'll take the scope out.
This.
Yeah, go forward. Good. See not this fold, go forward. Go forward. This fold, over this fold. Tip up. Now, anti-clockwise. More. Blow water. No, you're doing tip up. Anti-clockwise. Blow water. Anti-clockwise. Blow water. No. Stop, stop, stop. You're doing this. You don't need to do this. Okay? You don't need to do this. You just need to do gentle movements. Your movements are too brash. Okay? Let your movements come in. Blow water. And then tip in. See it? Blow water. Not air. Water. One go. Slow. Forward. Now, anti-clockwise. Blow water. Blow water, not air. Anti-clockwise. Now tip up. No.
Mistake.
No, you take. Take the scope out, nice and slow. Good. So we've been in. Come back nice and slow. No, take the scope out. Good. That's because we've been in several times. Good. Keep coming. Threadworm. Just threadworm. You can see pinworm. To the right. Oh. Threadworm. Come back. Don't go in this. We'll try the IC now. There you can see. Yep. Yep. Okay. You want to give him a drink?
No.
Take the tube out. Nice and slow. Withdraw. Keep coming. Keep coming. You've had your go. Good. Keep coming. Nice and slow. Keep coming. Nice and slow. Keep coming. Good. Your hand is not straight to the scope. That's better. Good. You're holding the scope really well. Just relax your hands.
पल्स ऑक्सीमीटर ठीक करो पेशेंट
Good.
का पल्स ऑक्सीमीटर
Relax your hands. That's it. Good. Relax your hands. Little bit of air. Blow. Good. That's enough. Good man. Keep coming back, nice and steady. 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 Good. Put him back on his left side. Good. Keep coming back nice and steady. Let the scope relax in your right hand. That's good. Good. Let the scope relax in your right hand. Good man. Okay. Keep coming back nice and steady. Keep coming back. Keep coming back. Don't take any more air out. Leave the air as it is. Keep coming back. Keep coming back. Keep coming back. Keep coming back. Slow down. Slow. Keep coming back. Keep coming back. Slow. Right. Now, put some air in. Insufflate. Okay. Now, what we're going to do is retrovert. So, let him know what you're doing.
थोड़ा सा push करेंगे.
Not him, the patient.
Patient.
Oh, yeah.
थोड़ा सा ना हम थोड़ा look डालिए थोड़ा सा देखिए.
Okay, so big wheel all the way back. Little wheel all the way back. Both back together. Advance the scope. Slowly. Slowly, man. Clockwise torque. Okay, too far up. No. So what happened there? Let me show you. No, let me show you. You actually went in and then you went up with the scope, right? No. Come back to here, where you were. Slowly pull the big wheel back. Then slowly pull the little wheel back. Then advance, okay? Hold the scope in that position. Get the scope central. Central. Right. Now, stop. Right. You've allowed. Right. Clockwise torque and stop. Advance. Stop. Now, big wheel back. Advance the scope slowly. Advance the scope. Little wheel back. Advance the scope slowly. Clockwise torque. Keep the torque on. No, don't need to do anything with this. Keep these wheels back. Right. And clockwise torque. Okay, stop. Let me show. Right, so you've gone round that bend again, okay? So, big wheel back, little wheel back, keep the scope straight, advance the scope, okay, in a straight line. If you can't tolerate it, then we stop. There we go. See there, see there, see there, that's yourself, okay? Suction on, suction on, suction on, suction on, keep it on. Well done. So, How are we doing, my friend?
Start or finish that?
Just finished, man.
You okay? Fine. We finished that one. You want to? I just want to do a quick deep